to talk a little bit first about the question and whether we're even asking the right question. But the first thing I wanted to do was put up a very busy slide and an Australian study looking at prescribing errors. And what I wanted to point out was this lack of drug knowledge was not the single causative factor in any incident. And this talks about various systems problems, various defence problems, and interestingly, this culture that prescribing is a repetitive, low-risk chore that's not really that important. So what I wanted to say first of all was I completely acknowledge that education is only part of the solution. And sitting listening this morning, I wonder if part of it is that we feel that actually education is one of the few things we have control over, that we feel we can do something about. And a lot of the systems problems, at least to me as a relatively junior person still, seem to be something that's out with my grasp to change. So there is this question about, is education the solution? And I'd like to argue that education is probably one part of the solution. And I'd like to point out that some of these things, knowledge, skill in prescribing, attitudes underlying what we do, can be addressed by education, and education is in some ways the obvious thing. After all, we wouldn't have medical schools if we didn't think that education taught medical students to become doctors. There's something in the question that's a bit kind of self-evident. So I would argue that logically education should improve prescribing on the grounds that if you teach somebody to do something, you would hope to get a good outcome. And certainly, as we've seen from other people, that's what medical students and junior doctors say themselves. They feel this lack. So does education work is the question that I was set. And I've actually changed my slides and not sent them down, which was not very helpful. But I thought actually the question wasn't so much does education work? The question is there any evidence out there for educational interventions that have been shown to improve outcomes? And that's a different question, I think. And then I thought, well, actually some of it then says, is any educational method better than any other method? And is there evidence for that? So as part of the prescribing initiative, we undertook a systematic review looking at educational interventions to improve prescribing by medical students and by junior doctors. And we looked through the usual things that you would expect a systematic review to do. We looked in primary and secondary care settings. We looked, as I say, for medical students and junior doctors. We weren't just looking at prescribing errors, we were looking at any kind of measure of prescribing quality, and in that, again, there is a certain difficulty. We didn't include things that thought that education was just a bit of paper that said this is how you should do things. And we didn't look at complex interventions that used education as a part of a bigger picture. So we did this in the usual fashion, and one of the things that we were interested in was looking at perhaps the best evidence medical education, the Cochrane models, and looking at the quality of the studies, both in their kind of intrinsic quality, but also in the kind of outcomes for education that they showed. So we thought initially that we might have a chance of doing a meta-analysis. We very quickly realised that was just not going to happen because the studies were too heterogeneous, and therefore we provided a descriptive report. So we started out, we managed to find about 3,000 studies, and we ended up looking at 22 of them, which I think is probably to be expected. We came up with 11 controlled trials of some description. These used either written scenarios or sometimes OSCE-style stations to look at prescribing, and I'll come on to some of the issues around that. 10 out of the 11 showed some difference in the groups between those that were given some sort of educational intervention and the others. And the single study that looked at real-life prescription errors by junior doctors and whether an education intervention worked showed no effect. There were 4 before and after trials, so as sometimes happens in education, you see the students, you give them a test, you then do the teaching, you give them another test, and did things change? and they all reported improvements in whatever measure they used. And we also found 7 studies with absolutely no assessment of their intervention. Some of those, the students liked them, and some of those didn't even get as far as happy sheets for the students. So overall, we felt that the quality of studies was pretty poor. Small numbers of participants, often self-selected. We felt that the assessments weren't necessarily accurate to real-life prescribing. There were situations where only one OSCE station was used as the assessment, and I'm sure as those of you who are involved in OSCEs are aware, multiple stations are usually needed to provide reliable answers. A very limited number of disease topics were covered, and then a whole lot of issues about randomisation and blinding and whether there was a concurrent control group. And nobody really seemed to take any account of what stage the students were at anyway and what they should be able to do. So I've said some of this already. We really felt that the validity and reliability of the assessments that were being used were not measured and probably were not particularly good. We thought that the generalisability of results were not very helpful. And the thing that stood out, the only model that seemed to have any kind of reasonable evidence was the WHO Guide to Good Prescribing, which was produced in 1994, and I'm sure some of you have used. It was tested over a number of different countries on a number of different types of student in different programs. They looked at different disease groups. But again, there were some questions about how well the assessments actually judged the quality of prescribing. And everything else really was only a sort of single centre study with very small numbers. It was very difficult to evaluate effect sizes as well. Just because somebody did a bit better on a test didn't really tell you an awful lot, we felt, and there was no way of saying that the test from one study was equivalent to the test in another study. And I guess our criticism of the WHO model was that it looked like you were getting equivalent marks for each stage of the decision and then prescription writing process, and you might argue that perhaps some things are worth more weight than others, but nobody seemed to have kind of thought about how it translated into an assessment model. I mean, this was published in June this year, and therefore I thought I should have a look and see if there's anything new in the literature since then. I came up with one Canadian study of interns in family medicine who had quite a lot of teaching sessions, 12 teaching sessions on prescribing. They were taught to use a particular mnemonic, but again, there was no assessment of whether they were any better at the beginning or at the end than they'd been at the beginning, but they all liked it very much. And again, there's been a UK review of teaching of junior doctors about prescribing errors in paediatrics, and they found that training was very variable and that there wasn't a valid assessment out there. And so my conclusions are, can you answer this question? I said, well, there is some evidence, but I wouldn't say that it was great evidence, and there are certainly many methodological issues with it. There's little evidence in junior doctors. A lot of these studies were in medical students. And really, I'm not sure that any of this gets us an awful lot further along the line of saying, how should we teach prescribing? If we agree that more teaching is what we needed, then there's really not a lot to guide us on how that might be done, except to say that we want to be on the practical end of it rather than perhaps the theoretical. So what else is there to do? Well, you can't assess something if you don't agree what the outcomes are, and I think there's been some work by the BPS looking at trying to get a consensus on what actually good prescribing entails. I think we do need to look at what we're doing, because obviously we're all teaching medical students prescribing, but it's not in the literature what we're doing, and perhaps that's something that we should be looking at. And I think really if you're going to measure whether your teaching works, then you need to have a valid and reliable assessment, and again that's something else that the BPS have been working towards. So thank you very much.